Here are the top 5 knee arthritis secrets that no one is talking about. Number 1 is that cartilage can heal. The body is designed to adapt to the forces you put on it. And no one talks about this when it comes to cartilage. In fact, if you look at the medical research about cartilage healing, there isn't much out there and it's very mixed. Some shows that it can heal and some shows that it can't. We just don't know. In my opinion, we don't have enough hard evidence that it can go either way, which doesn't mean that it can't heal. It just means we don't know. But there are some laws out there that are generally accepted in the medical community. One of those is Wolff's Law, which talks about how bones get stronger the more you use them and weaker the less you use them. And then there's a similar law for soft tissue, specifically tendons and ligaments. It's called Davis's Law, which talks about how tendons and ligaments get stronger the more you use them and weaker the less you use them. And then there's one related to the heart called the Frank-Starling Law, which talks about how the heart will work harder the more it fills up with blood. The whole principle behind all 3 of these laws is that the body adapts to the forces you put on it. It's designed to do this. We don't have any laws like this that I know of or that I've heard of that relate to cartilage. But what we do have is evidence from my own practice, from patients we treat here in my clinic and people we're helping online. I have a program called the Knee Arthritis Recovery Program, and it's designed to carefully put forces through cartilage in the knees at rates that they can accept, rates that are comfortable, so that the cartilage can heal and get better over time. And we have massive success with this. People are getting better. Their cartilage is feeling better. I can't say specifically that their x-rays look better. I can't say that the cartilage is truly thickened or healed, but what I can say is people get to the point where they're back to doing active things, their knees aren't swelling anymore, and they're feeling fantastic. So there's got to be some healing happening because of those laws that I talked about and because we don't know, we don't have hard evidence about cartilage not healing. The second secret is that the knee arthritis grading system is flawed. I'm talking about the Kellgren-Lawrence grading system. And this is what doctors will look at and compare your x-rays to whenever they're figuring out what to grade the severity of your knee arthritis. And it'll start from stage or grade 1 and it goes all the way to grade 4. And grade 1 means that your knee is showing tiny signs of arthritis problems, usually like bone spurs. And then as you go along in the grading system, by the time you get to grade 4, it's severe. You have like massive bone spurs, the joint space is gone on the x-ray, and they're definitely recommending a knee replacement at that point if you don't feel well. The reason why the system is flawed is because it doesn't account for a few things. It doesn't account for the fact that you can feel better even though you have a really bad or severe grading on this system. So you can technically be grade 2, 3, or 4 and have all these bad signs on your x-ray, but feel fine. We know this by research that you can have bad knee arthritis, but be able to walk just fine and do most things without pain. So if doctors are using this system and then recommending a knee replacement based on this system, of course, they're going to take into account your symptoms, but it's not the complete picture for an individual. What if you can improve? This is why I've developed a whole different system. I call it the phases system of healing for knee arthritis. This is what I've included in my knee arthritis recovery program. And the way this one works is you can move back and forth between these based on the severity of your symptoms. So never mind the x-ray, because we know based on research that the x-ray isn't the biggest determining factor in whether or not you should have a joint replacement. If you're in grade 4, then it's more likely. But a lot of people are in grades 1, 2, and 3, and they can manage just fine without having a joint replacement. So if you can figure out what phase you're in, if you're at that point where you don't need a knee replacement, it's very possible for you to heal, then you can figure out, all right, what do I need to do in phase 1 so that I can move into phase 4 where you're in the maintenance phase. And even if you are in phase 4 and then you do something to set yourself back into phase 1, now you have a plan to get out of that inflamed state where you can't walk very long, you're swollen, your knee's hurting, it's keeping you up at night, all those factors that come with arthritis, you can manage that. And the final thing about the grading scale is that this is the scale that doctors use the words bone on bone knee arthritis with. Because when it comes to grade 3 and 4 especially, that's when you have a decreased joint space. The bones are more close together, and so the doctor's more likely to say the words to you, bone on bone knee arthritis, which then you can't unhear, especially when you see your x-ray on the screen at the doctor's office, and it just puts pictures in your head of what the inside of your knee looks like, when in reality it can be helped. And it causes fear in people because they think, well, I shouldn't be walking around, I shouldn't be doing anything strenuous, I shouldn't be carrying anything heavy, I need to lose weight. They start to have all these thoughts that might actually slow them down from doing activities that are helpful for improving their knee health. But they have fear about doing anything because they've been told they have bone on bone knee arthritis, when it's much better to be told what can you do and what should you be doing according to how your knee feels right now, despite what the x-rays look like. The third secret is that knee replacement surgery fails more than they tell you. Did you know that there's up to 20% failure rate on knee replacement surgeries? This is shown in research. And then let me get the stats for you here. There's a 10 to 34% chance that you're going to end up with chronic knee pain after having a knee replacement surgery. This doesn't even account for the discontentment rates. I don't have those numbers for you right now, but there are high numbers of discontentment in people that have had a joint replacement in their knee. Now, there's some people that are absolutely content with their knee replacement and they're so happy they got it, and that's fantastic. I'm glad for those of you that are in that situation. But there's also a lot of people that regret having a knee replacement surgery because they feel worse or the same and they went through all the trouble. And then there's this stat. You have a 30 to 45% chance of having another joint replacement once you've had the first joint replacement. So if you already have one knee replacement, then there's a 30 to 45% chance you're going to have a hip replaced soon or the other knee before your life is over. I think the reason this happens is because of my fourth secret here, and that's that quad strengthening hurts knees. What happens a lot of times in people with knee arthritis is they get told to strengthen their quad muscles. Those are the muscles in the front of the thighs. The reason why they get told to strengthen quad muscles is because there's research that shows that in people with knee arthritis, there's a correlation of weak quads, or they call them knee extensors in the research. But I always have to question, is it that they're finding weak quads in people with knee arthritis because the knees are painful and they just haven't been exercising? And so as a result of less activity because of knee arthritis, their quads have gotten weaker? Or is it really that the knee arthritis is causing the quads to be weaker? It's hard to tell based on the current research out there. It's not 100% clear. But what is 100% clear is that if you go do exercise for knee arthritis, everywhere you look, just about everywhere you look, you're going to find recommendations to do quad exercises, which means you're doing knee extensions or exercises that make you use these thigh muscles more. And I don't like that because it sets up the fifth secret that I'm going to tell you about here, and that's there's muscle imbalances at play here that are the cause of knee arthritis. When you use those quads too much, the reason those quads are used too much is because the glutes in the back of the hip here are not used enough. And so it's a compensation that happens. When the glutes are not strong enough and they're not active enough, then you're going to use your thigh muscles too much, and that causes that excessive compression down here at the knee because those quad muscles attach to the kneecap, and then there's a tendon that attaches down to the shin bone from the kneecap. So when all these muscles are pulling too much because of that weakness up here, that's the key. These quad muscles start to press the kneecap against the thigh bone, and it starts to pull this shin bone up into the thigh bone, and it just compresses everything in here. And when you get that increased compression over a long period of time, now you have those laws that I was talking about starting to take effect. The underlying principle is that the body's going to adapt. And it's just a matter of time before you start compressing the heck out of that cartilage, and it can't adapt properly because it's too much force. And then the bones are trying to adapt, so you get bone spurs developing. The joint's literally being squashed. We have to decompress it, but in order to do that, it's not all about weight. Sometimes it is for some people, but it's way more about the muscle imbalance. And if we can get these glutes to work, then it'll cause the quads to calm down and not be overused, and that should decompress the joint. Okay, I want to tell you about our knee arthritis recovery program. This program is specifically for people that have knee arthritis, whether you've been formally diagnosed, you've had an x-ray or an MRI and the doctor told you that you have knee arthritis, or you suspect you have it, and it doesn't matter how severe it is. If you've had it just mild, grade 1, some doctors will tell you, or if it's more on the severe end. If you have tried exercises and advice and tips that I've given you through our videos here, then chances are have benefited from it because this stuff works. Chances are even better that you're going to get tremendous improvements if you join this program. And let me just tell you how it is real quick, how the program's set up. It's a membership program. There's different tiers of this. On the first tier, it's group coaching along with the whole curriculum of 40 plus. I think it's approaching 50 videos now showing you how to do it. So you can just go through the program, watch the videos, and have massive improvements. But you also get access to group coaching where I'm on the call with you, me and my coaches, and you get to ask us questions so that you don't get stuck through this program. And then you also have the option to get our higher tier, which is one-to-one coaching with our recovery coaches, but you still get the group coaching too. And of course you get the whole curriculum as part of that package. So go check out the link nearby here to learn more about the knee arthritis recovery program. And I hope to see you in the program on our coaching calls. I have must-watch information for you if you have knee arthritis. It's in this video right here. This is required viewing. If you have knee arthritis, you're gonna wanna get key information about how to think about knee arthritis and what treatments you should be pursuing to heal naturally and avoid surgery.